Good morning, everybody. This is Dr. Jeff Culbert from Schooley's Mountain Chiropractic Center. And if you have been watching our channel, we have been putting out a lot of videos. We've been doing a couple of interviews, some great patients. We just concluded an interview with Wayne. I hate to tell you guys, it's a 52-minute video. This is going to be one of those things you're going to want to watch over a long period of time. Either chip it down into Pomodoros like we talk about in the interview, or just plan. It's a rainy day, get some popcorn, sit down with your family, plug it into your big screen TV, and watch Dr. Jeff and Wayne for 52 minutes, because Wayne gives you some phenomenal insights to, one, chiropractic, but two, it's a journey of a patient who does not have your run-of-the-mill stuff. As Wayne explains in his video, he had a car accident back in the 70s. He broke his neck. Ultimately, that ended up with a cervical spine fusion. He had a tumor in his elbow that led to the elbow being fused, so he really doesn't have much of an elbow. He had a foot injury in the car accident where the foot got fused and eventually the ankle got fused. So between limitation of motion in the neck, inflammation and irritation from the surgery going on in the neck, the limitation of the joints in the lower extremity on the right, creating a limp, condition going on with him with some disc degeneration, arthritis, some stenosis, that has presented a complicating factor. So you guys who have watched our videos in the past know that we use 6 different techniques in the office, from diversified, which is the traditional chiropractic adjusting, where you hear things moving, popping and snapping, okay, or releasing the pressure of the gas as the joints are being gapped. We use activator technique, we use SOT, we do extremity adjusting, we do the flexion distraction. So we use a number of different techniques, some more aggressive and some less aggressive. So with Wayne having had some of these areas fused and fusion in the neck, I can't go into a lot of spots and be very heavily adjusting him. But the good news is, with what we do and the approach that we take, we find what needs to be adjusted, we start to fix it, and as we're monitoring his condition from visit to visit and with re-exams, when things are starting to work, we know when to leave something alone and let the body start to do its healing on its own. So without any further ado, I'm going to let Wayne wave his hand, say hello to everybody, okay? And we're going to get started. And again, as most of you know, we always come in and we evaluate a patient. We start off by looking at leg lengths, and Wayne generally starts off with a left short leg, which he does. And we're going to come in, and again, we're just going to do some basic AK checking with some muscle testing. And he's got that left SI joint that goes with the left short leg. He's got an anterior femur. Hold the arm up again, Wayne. Thank you. Hold. No. Just the arm, not the leg. There we go. Great. There's going to be a psoas muscle. We'll check that in a minute. Now we're just scanning the intestines. He's got the kidney acupuncture points that are a little bit off. And then we're going to come in, hold up again, Wayne. Now again with Wayne's fusion in the cervical spine, we're just checking some things. And there's a little bit of a thyroid point and an anterior cervical disc that we'll get with the activator and a little stimulation. A little bit of lower cervical fixation that's there. Upper cervical spine. Okay, now again, for everybody out there that's not familiar with AK, it stands for Applied Kinesiology, or Applied Muscle Testing. And again, one of the things that we do here in the office with it is we kind of use it to let your body be a little bit of a diagnostic tool for us, in the fact of, everybody's familiar with facilitatory reflexes. So if I took a reflex hammer to Wayne's knee, you would see something jerk, okay? Facilitates a reaction. There are also what are known as inhibitory reflexes, and those are monitored and controlled by what are known as Golgi tendon organs. So when Wayne is holding up an arm strong and I hit something that's working, there's no firing of Golgi tendon organs, so the arm stays strong. But as soon as I hit an area of the body that is not working properly, Golgi tendon organs kick in to give a withdrawal response. It's more important for him to pull that arm away or get weak than it is for me to go and irritate something that is not working and it presents a possible irritation. So it's more of a withdrawal response. The Golgi tendon organs trigger and the arm goes down. Hence, I know what I have to adjust and what I get to be able to leave alone. So as we're working here, we're just doing a little bit of origin insertion technique. And this is to just help tone the muscle so that it helps to use the straps of the sartorius muscle in the lower extremity to try to get that pelvis to want to kind of anchor and lock itself in a little bit with some muscular support. From there, we're going to just work the kidney acupuncture points on the abdomen, and then we'll move up to the thyroid point and the cervical spine area. We'll use the activator for the hidden cervical disc. We'll use the activator to adjust. Now again, with the fusion in the neck, I can't heavily twist and turn something without potentially breaking something, which is the last thing we want to do. It would not instill the confidence Wayne has gotten in us if I did something to do that. So, now Wayne, with everything that went on last night with that crazy rain that we had, how'd your body hold up?
Not good. Not good at all.
Okay. Now, for patients that are out there, again, Wayne has involvement with the kidney acupuncture points, one muscle particularly known as the psoas muscle, the kidney acupuncture point, upper traps. Things that are related to the kidney system seem to be more affected by changes in barometric pressure than other areas that are not kidney related to when barometric pressure changes. So with what Wayne has going on between the lower back and the condition going on there, and how it ties in with the upper cervical spine with the upper traps and what's known as an atlanto-occipital fixation. When we get the rain that we had here in New Jersey in Hackettstown last night, where I think it was 1.35 inches of rain overnight, when I was coming in to interview with Wayne and get him adjusted today, he mentioned 1.7 inches. So depending on where you are here in the local Hackettstown, Long Valley, Washington area, we got at least a good 1.5 inches of rain. And with that craziness, with the wind and the howling of the rain, I would not have been surprised if Wayne didn't say he had some irritation from what was going on last night. And again, if you're one of those people that does get interfered with the weather, we will generally recommend that you try to put a little extra ice on just to keep that inflammation and swelling down. And or something that's anti-inflammatory, whether that's Advil, aspirin, Motrin, arnica, boswellia, turmeric, bromelain, some 24/7. And right now we're just doing some pressure over the upper trap to try to get that to relax a little bit for Wayne. There we go. Almost feels like butter melting, doesn't it, Wayne?
Mm-hmm. Feel the shoulder just relax.
Now, what we're doing with Wayne right now is just doing a little stretch to the cervical spine, a little stretch to those upper trap muscles. I've got my finger in there, and we're just holding the pressure on the muscle until I feel that muscle start to, as I just said to Wayne, poof, or start to melt like butter, your thumb on butter starting to relax. The muscle will stay in tetany when you're irritating it, anywhere from a couple of minutes to up to 8 minutes. If I was to do this longer than 8 minutes for Wayne in any particular spot, anything longer tends to be an irritant to the muscle and would create a rebound spasm. And that's one of the one things we don't want to do with Wayne. Okay, hold your arm up again, Wayne. Thank you. Now, if you're noticing, we are rechecking the points that we adjusted with the activator and stimulated with just some reflex rubbing. And if you notice, those points are now working strong for Wayne. So we're going to come on in. We're going to work that psoas muscle, that anterior femur. And then we're going to get Wayne's lower back adjusted. Now with the lower back, we can still do a diversified adjustment with Wayne. So you'll see him get on his side and we'll be able to put some input into the lower spine, that L5, S1 area, the L2, L3 area, L4. And we will get some traction on. And then in that upper back area, we will use the activator. A little stretch to the neck. And then Wayne is off to his granddaughter's soccer game. Right? Soccer?
Soccer game.
Okay.
Well,
No rain after 11 o'clock here in New Jersey. Over the holiday weekend, I went up to Maine and ran into a nor'easter. So, okay. We're going to take those away. Thank you, Wayne. Now, if you can do me a favor, I want this arm up again, nice and strong. Hold. 5, 4. There's the 3. There's the 1. Okay. 1, 2, 3, 2. Okay, so Wayne's lower back today, we got a L3 and an L1 on the left and an L2 on the right. So Wayne, if you could do me a favor and just roll to your side and face me. I know, I got to be careful of the elbow. Breathe in and breathe all the way out. Good, thank you. Face the other side. When we adjusted Wayne, a lot of our videos, we get these phenomenal releases with a lot of patients. Wayne, because of the disc degeneration and the arthritis in the lower back, relax Wayne, breathe out. There you go. Turn on your stomach. I'm not trying to put a heavy thrusting adjustment in there. I want to adjust it gently so that I get the segment to move, but I don't put so much over force and rotation in there that it ends up creating an irritation and inflammation to any of the arthritis and create a potential nudge. So if you guys remember from other videos, we're always trying to make sure that we use the Goldilocks approach with each and every patient. Adjust what needs to be adjusted, but in a manner that is not too hard, not too soft, but just right to give the patient the experience and the input to the nervous system to shift the vertebra, start to take some pressure off the nerve, and therefore allow the body start to heal from the inside out versus the outside in. And when you listen to Wayne's video, you'll know Wayne has had a lot of outside in treatment. And the good news is he does very, very well with the chiropractic approach that we utilize with him. Because if it was too gentle, I don't think he'd be here. If it was too aggressive, I know he wouldn't be here. And again, we are just holding onto this psoas muscle a little bit until we start to feel that relax a little bit. And this is the part of care in an office where you can't rush with a patient. You just have to be patient to let the patient's body do what it's going to do in the time frame that it needs to do what it needs to do. So again, you can feel that muscle starting to relax there, can't you, Wayne? Yes. So, and again, we want to hold it long enough so that it relaxes, and we don't want to hold it so long that it becomes an irritant, and we don't want to rush through it so nothing gets done. And again, it should be being able to be felt right about now, starting to relax over that piriformis muscle. And a lot of times we'll just give it a little extra pressure and let it start to relax a little bit more. There we go. So if you notice, when we're doing the leg checking, Wayne has a fusion in his ankle and his foot. So what we look at with the activator method is more of a relative leg length change versus a correct, strict anatomical leg length change, because the fusion has made one leg definitely longer, and as you can see, it doesn't flex the way the other foot does. So we're looking for relative leg length changes for Wayne right now. And with the activator analysis that we're doing, this is more of a pressure test than the strict isolation test that activator generally teaches, where hands are moving like crazy. And part of that is with Wayne's left shoulder and left elbow being restricted to the motion that we would want for some of those isolation tests, we opt for more of a pressure testing evaluation with the activator than the strict isolation test that they teach you in their seminars. Now the beauty is, I used to be an instructor for activator, so I know all these little shortcuts that I don't know if they always teach anymore, but it is a great resource. And believe it or not, when you have somebody that has no ability to move an extremity, you can ask their brain to think of the motion and it'll show up a pattern. So it's just some of the stuff that is out there that after, I hate to say it, Wayne, you practiced for 32 years?
Yep.
Oh my God, this is 39 for me.
Yeah.
So these are sometimes the gems of wisdom and experience that 39 years will bring, right, Wayne?
Yeah.
Here we go. Now, one of the things that we're going to do today with Wayne that's a little bit different than we would normally do when he's here in the office and we're fully staffed is normally we'd do a little bit of trigger point or cold laser onto his lower back. But with no staff, I'm just going to put on a little bit of what is known as 24/7 relief cream. This is a phenomenally great herbal cream. Do not ask me to pronounce all the herbs that are in this because I do not have the phonetical skills, just as I cannot speak French, Spanish, German, or any other foreign language other than English, because I just don't have that gift of phonics to be able to say all of these words. But it's 7 different herbs in a phenomenally great combination that is analgesic, it's topical, and it works far better than anything like BioFreeze or Mineral Ice. It is just phenomenally great stuff. So we're popping that on to Wayne today. How we adjust somebody in the office that needs a little bit of extra care and attention. They can't be taken care of like a traditional chiropractic adjustment where, you know, the old joke is you put them on the side, you roll them right, you roll them left, you pop the middle of the back, you twist the neck right and left, and on their way they go. Can't do that with Wayne. Special circumstances between the fusion in the feet and the ankle, the limitation of motion with the elbow and the shoulder, and the fusion that's been there in the neck. We treat him very different. But the good news is that Wayne has gotten great results in our office since he started in February. And again, it's a slow and steady process because of the comorbidities or the complicating factors that are there for Wayne. Responding well to care and doing great. So again, if you've seen anything in this particular adjusting video of ours with a patient that has inspired you to want to go out and seek a chiropractor, seek somebody who has multiple different techniques that they utilize, has had some years of experience so that they know when something complicated comes in, not to freak out, be able to say, let's see what we can do to help you in a reasonable period of time, provide relief, and then offer the support, corrective, and long-term wellness care if that's what's in the patient's realm of mind and thinking of what they want to do. You meet the patient where they are at, you create a relationship, and you go on your journey together. The doctor is the coach, the patient is the player, and together with great communication and feedback to one another, open communication, working well with one another, phenomenal results will come. Remember, it's a process, and all processes require time. When there's limitation to tissue, you got to understand that you may never get 100%, but you try to get as close to 100% as you possibly can over the time and the duration that the patient will work with you. And if you need to, like we do with Wayne, you create a team approach where not only is he working with me as a chiropractor, but he has his medical team working with him as well. This is Dr. Jeff signing off from Schooley's Mountain Chiropractic Center. Hit like, hit subscribe, hit the bell, refer and share to others, because we would love to not only see our channel grow, but more importantly, see chiropractic grow and create that wellness revolution where people are more health conscious than they are reactive disease conscious. So Dr. Jeff signing off from Schooley's Mountain Chiropractic Center. You guys all have a great day, and we'll see you in another video real soon. And again, Wayne, thank you so much for your help today. Really appreciate it.